The journey of sperm to conceive a baby. The journey of sperm to conceive a baby is a complex and amazing process. Here are the main steps of this journey. Production. The process begins in the testicles, where sperm are produced. This process takes several weeks. Maturation. After being produced, the sperm travel to the epididymis, where they mature and gain the ability to move. Transportation. During intercourse, the sperm are released into the vagina. From there, the sperm begin their journey toward the uterus. Swimming. The sperm travel through the cervix, then into the uterus, and finally into the fallopian tubes. This journey requires great swimming and survival skills. Fertilization. If there is a mature egg in the fallopian tube, fertilization can occur when the sperm meets the egg. Implantation. After fertilization, the fertilized egg, zygote, is formed and begins to divide. It travels to the uterus and implants in the lining of the uterus, where the journey of pregnancy begins. This process is the foundation of life and illustrates the complexity and beauty of how humans are made. What are the stages of pregnancy after fertilization? The stages of pregnancy after fertilization go through several main stages, usually divided into 3 trimesters. Here are the details. 1. Stage 1. Months 1 to 3, fertilization. It occurs when the sperm meets the egg. Cell division. The fertilized egg, zygote, divides to form a group of cells. Implantation. The cell mass reaches the uterus and implants itself in its lining. Fetal development. The main organs begin to form, such as the heart and brain. 2. Stage 2. Months 4 to 6, fetal growth. The fetus continues to grow and the organs begin to function. Physical changes. The woman begins to notice changes in the shape of her body, such as the protrusion of the abdomen. Movement. The mother may begin to feel the fetus moving at this stage. 3. Stage 3. Months 7 to 9, final growth. The weight of the fetus increases and all the organs are fully developed. Preparing for birth. The body begins to prepare for birth, and some changes may occur, such as Braxton Hicks contractions. Childbirth. At the end of this stage, the birth process occurs, where the fetus exits the mother's womb. Summary. Pregnancy is a complex process that involves many physical and hormonal changes and usually lasts about 40 weeks. If you have additional questions about any of these stages, do not hesitate to ask. What are the common symptoms at each stage of pregnancy? Here are the common symptoms at each stage of pregnancy. 1. Stage 1. Months 1 to 3, delayed menstrual cycle, one of the most prominent early signs of pregnancy. Nausea. Some women may feel nauseous, especially in the morning. Fatigue. Increased fatigue and drowsiness due to hormonal changes. Breast sensitivity. A woman may feel pain or swelling in the breast. Frequent urination. Increased need to urinate due to pressure of the uterus on the bladder. 2. Stage 2. Months 4 to 6. Weight gain. Noticeable weight gain due to fetal growth. Fetal movement. The mother may begin to feel fetal movement. Improved nausea. Nausea often decreases at this stage. Back pain. A woman may experience back pain due to physical changes. Skin changes. Dark lines or spots may appear on the skin. 3. Stage 3. Months 7 to 9. Details of the third stage, months 7 to 9, of pregnancy. The third stage of pregnancy, covering months 7 to 9, is a crucial period as the baby continues to grow and prepare for birth. Here are the key details. 1. Physical changes. Increased size. The abdomen expands significantly as the baby grows, often leading to noticeable discomfort. Weight gain. Most women gain a substantial amount of weight during this stage, typically 1 to 2 pounds per week. Breast changes. Breasts may become larger and more tender as they prepare for breastfeeding. 2. Symptoms and discomforts. Shortness of breath. As the uterus presses against the diaphragm, many women experience difficulty breathing comfortably. Frequent urination. The growing baby applies pressure on the bladder, leading to increased urination. Swelling. Swelling in the feet, ankles, and hands is common due to fluid retention. Back pain. The added weight can cause significant strain on the back, leading to discomfort. Braxton Hicks contractions. Irregular, practice contractions may begin as the body prepares for labor. 3. Emotional changes. Anxiety and excitement. Many women experience a mix of anxiety about labor and excitement about meeting their baby. Nesting instinct. A desire to prepare the home for the baby often kicks in, leading to organizing and setting up the nursery. 4. Fetal development. Growth. The baby continues to grow rapidly, gaining weight and developing fat layers. Movement. Kicks and movements may become more pronounced, and the mother can often feel the baby's position. Organ maturation. The baby's organs mature, and the lungs prepare for breathing air outside the womb. 5. Preparation for labor. Pelvic pressure. As the baby drops lower into the pelvis in preparation for birth, many women may experience increased pelvic pressure. Cervical changes. The cervix begins to soften and may start to dilate in the weeks leading up to labor. 6. Healthcare visits. Regular checkups. Frequent prenatal visits become essential to monitor the health of both mother and baby. Labor planning. Discussions about labor preferences, pain management, and delivery plans often take place. Summary: every woman may experience different symptoms, and some symptoms may be more noticeable than others.
Be sure to subscribe to Top 5s with notifications on.